but when you're applying pressure through the foam roller, you're going to be affecting the skin, muscles underneath, the fascial system. You're going to be having an effect on the nervous system as well. We don't want to be pressing really hard as we do these exercises. So if you find that you're wincing when you're leaning on body parts, that's going to be tapping into a pain cycle, which will usually make the body respond by tightening and pulling away. So using the foam roller wants to be quite a relaxing experience, and we're looking to have slow, rhythmic movements to try and encourage relaxation into the tissue or down regulation of the muscles to remove these tight areas. So we're going to get started with a release of what we call the front line or the anterior line of the body. This is the line that's going to extend all the way up the front, through the abdomen, up through the chest and towards the neck. Now, the body is not just one muscle with one start and finish point. It's one very long line of interconnected tissue. And we may find that you may just release one area of this front line and it will have a compounding effect somewhere else within the body. So you don't necessarily need to do this whole process or full anterior line. Another interesting point here is if you are kyphosed, where the rib cage has a posterior shift or a backward shift within the ribs. Some work may be required to extend the spine, and you may be choosing to do some resistance work to strengthen the back, which would definitely be part of your program. However, before we start creating that ability to strengthen in the back, we need to open up and create space. So if you are somebody who has a kyphosed position, or if you're used to being quite slumped, this area of your body on your anterior line is probably going to be very tight. So this needs to be opened first before you start then looking at some strengthening work for the back of the body. So let's get started. I'm actually going to start today with the front line using the half roller, but I'll show you some variations as we go. So we're going to start off with the muscles at the front of the shin. So this is tibialis anterior and our long toe extensors. These muscles can become really tight from walking, especially as we transition into spring and summer and we end up walking in sandals or flip-flops. So I'm going to place the roller here. Variation 1, I'm going to come in with both of my knees, resting my hands on the floor for support, and the roller starts just below my kneecap really. And I'm just going to really slowly roll from side to side. It has sort of like a kneading motion to it. And I'm going to go from the shin bone and across the muscle tissue. And each time I move here, I'm having a sense of just gently compressing into that bulk of muscle. Now, if I find an area that's particularly gnarly or a bit sore, I can stay there and just have a little bit of extra work. But you don't need to spend a long time doing this. I'm just going to speed up a little bit, and I'm going to be rolling forwards all the way now to the front of the ankles. So we have a thick band of fascia there at the front of the ankle, which is part of our extensor retinacular there. And just some gentle movement here can actually improve the depth of your squat quite nicely, or your sitting pattern. Now your other variation here would be with a round roller. I would recommend you just do one shin at a time here. So it would look more like that. Just gently with a lot of support through your leg and your hands. Then we're going to move up, continuing on through this front line, and I'm going to work just above the kneecaps. Now, I'm going to come forwards here onto my tummy. You might want to miss this part off altogether. Your main watch point is that you don't sink into the body. So you need to be able to maintain a strong lift in the tummy here. And again, we're just going to have a little roll from left to right. If you want to add some longitudinal motion, you can do a little knee bend and release, and this is going to stretch the tissue long ways or lengthways. So we do that a couple of times, maybe 4 maximum, and then again we can just sort of waddle or scooch our way along the roller. And again, if we find a point that's particularly sore, we can wait here, do some more little rolls, and then ultimately we're going to be rolling up towards the pubic bone and then rolling just to the side of the hip here onto TFL. So TFL will look a little bit like this, a nice slow roll. Now, TFL is sitting just to the side of your pelvic bowl, your pelvic girdle here, and it's sort of where you might just slide your hands into your pockets. Remember, do not roll or lean on the front here in your pelvic triangle. You have a lot of vessels and nerves sitting here, and you don't want to be applying a lot of heavy pressure. If you're using the mobile roller, again, just come onto one leg at a time, and then you can actually have some motion happening here with this roller, forwards and back, and then you can do some gliding side to side as well if you want to. We then move up and carry on up the chain, and we're going to come into a suprapubic release. So the roller is going to go just on top of the pubic bone or nudging up against it. You're still very much on soft tissue, and this is the base where rectus abdominis comes down and merges into the pubic bone. So again, we're going to lie down. I'm just going to lie on top of the roller here and just sink. Allow my body weight to sink into it. And then again, tiny little roll right and left. If you want to and you know what you're doing, you can add in some little pelvic tilts. And for many people, this area is really sore, especially if they are quite compressed through their anterior chain. Once we've worked on that area, we're going to come up to the top of the rib cage here, where your ribs come up and join your breastbone. So for women, it'll be just sort of below bra line. And we're just going to rest here and just roll very slowly from one side to the other. So a very slow roll. And again, if I find an area that might be a bit sore, I can just stay and do some very gentle oscillations on that area. Now from here, you don't want to be putting the foam roller up near your neck anywhere, but you can do some self-release into your sternal fascia here. So maybe just allow your fingertips to sink in between your rib lines, and then slowly drag down. So you sort of put your fingers in and get them to melt, and then drag in a downward direction. Now, we can also extend the neck at the same time, and you can really feel then this lengthening and opening through the front of the body. So that would be your front line foam roller release. We're going to look now at the lateral line of the body. So these would be the muscles that run from the side of the leg all the way up, side of the hip, coming through into the back area and the rib cage. And then if we're looking within our Anatomy Trains model, it would come up again through sternocleidomastoid as well. So I'm going to use the shorter roller for this one. So I'm going to be starting with the side of my leg on the roller, supporting with my other foot and my arm, and I'm just going to be slowly rolling away and back up. And again, just maybe looking for about 4-5 repetitions, that's all you need. And if I find a gnarly or sore bit of tissue, I can maybe just glide, so that's that action. Or I can roll backwards and forwards a little bit over that area. Then I'm going to move up. Now on the side of the leg we have a very thick fibrous band here called your iliotibial band, or ITB. This strip of thick fascia is supposed to be very strong. So you're going to get a lot more benefit if you've been told that you have a tight ITB from releasing above and below and to the sides of it, rather than actually rolling on your ITB itself. So we've just looked at below on the top of the perineals and near the head of the fibula, and we're going to come now looking at VL in particular. So this is vastus lateralis, the side portion of the quads. So you'll feel your band here, your iliotibial band, it sort of tucks in, and we're going to come onto the strip of muscle just above it. So I'm going to rest my leg here. Again, most of my weight is on my hands and my other foot, so that I'm not leaning too heavily into the tissue. And then just slowly rolling, maybe now cutting my leg in half and doing halfway towards the pelvis, a few rolls, and then halfway down into the knee, doing a few rolls. And if I find anywhere that's particularly painful, I can stay there and either roll backwards and forwards or adding a shearing motion. Continuing up into the body now, we come into the side of the hips or your middle glute med. And that's quite easy to do. You can literally lie sideways on the roller. And again, we can do a small up and down motion, or we can go forwards and backwards. Now this lends itself quite nicely just to continue and work into posterior glute med, which of course you can do. We're just splitting things into lines for the purpose of today's video. So this is the side line of the body. Then we're actually going to move the roller up and it'll come into the waist. And we're going to just have a gentle roll backwards and forwards through the waist here. Now this is sort of catching the edge of QL, quadratus lumborum. And again, we don't want to lean too heavily here. You can use the foam roller here to add some opening into the upper part of the body as well if you want to do some reaches and extend, maybe sending your breath towards the armpit, and then you'll actually get some opening in the opposite side. We're then going to move up to the rib cage. So over this area you've got your serratus anterior, you've got your lat dorsi, and the rib cage, it is essential that it has good mobility and that it moves well. So a happy mobile thorax is going to have happy shoulders and a happy neck sitting on top. And you'll be surprised with gentle rolling here on the rib cage what sort of tender points or even trigger points are sitting here in these muscles. Just keep scooching it up as you go, rolling backwards and forwards, and you'll scooch all the way up nice and slowly until you get into the side of the arm. So we're here in this crease of the armpit. Resting here, so we're resting now on teres, the back of the shoulder, and also part of your lat tissue as well. And have a really nice slow roll back and forwards here. Now there aren't many people that I've met over my years of work that don't have some tender points or trigger points sitting here in the back of the shoulder. So just a nice gentle reach. You can add some arm movement here, so you can reach the arm away and bring it in, reach away and bring it in, or if you want to support your head, if your neck's getting a bit sore, you can literally work like this. Now you can see some immediate results from doing some of this shoulder work. So if you had limited arm flexion, just 4 or 5 repetitions here, and you'll find that you have really good mobility in the shoulders and freedom of movement here. Okay, so we're going to look at the back line of the body. This is your superficial line. The tissues are starting here from the underside of the foot. They travel around the heel, calf, hamstrings, back of the hips. They travel up the back and it ends up coming round on the top of your skull. So again, we're going to look at some muscular points here. I'm going to be starting off with my small roller again, but I'll just give you a demo as well as how everything can be done on a flat half roller. So we're going to start off with the calf tissue, and I'm going to place the roller in the lower third of my calf. I'm actually going to pop the other foot on top to give it some extra weight, but you don't need to. And we're just going to roll backwards and forwards. So when you have the round roller like this, you can have more of a rolling action. Again, if you find something that's sore, you can shear from left to right. So my leg's doing this now. I can also add in a flex and point action, which is going to tension and reduce the tissue running through the back. So I'm sort of on top of part of my Achilles. I'm also on top of the bulk of soleus muscle. So we've got flex and point, and then I might come up and work a little bit higher. Again, I've got a lot of support with my other leg and both of my hands. Finding a sticky point and adding a shear. Now, if I were to be doing this on the half roller, it would look really similar. So we're just going to rest the leg there, but this time I probably have more focus on rolling the leg from left to right, and then I'd add in the flex and point to get my longitudinal release or my lengthened release. And then I just move it up and go again. So both rollers are really good, both very useful. We're then going to come up to hamstrings and adductors. So we'll start with the adductors. This is the big muscle group that runs from your groin down to your knee. And we're just going to rest it here on the side. And again, just doing a small roll. So if you're having treatment, maybe with a massage therapist or your physio, and they're needing to do a lot of release into your adductors, then you can do this in between your sessions and speed up the outcome of your treatment. And obviously you can then come higher as well. Now if we just roll over a little bit, we're then on the belly of the hamstrings. Now again, maybe I could just add in some flexion and extension of the knee, or bend and stretch of the knee. I can add in some shearing motion, and I can add in some rolling. So I get the whole belly of the hamstring from left to right. We're then coming up to the back of the hips, and I'm going to swap over now onto my half roller. So with the back of the hips, we're going to rest and sit here. This would be the same setup with your big roller. And you're just going to roll from one side over the sacrum and slowly onto the other side. If you want to tighten up or stretch your tissue a little bit more before you roll, you can always cross your knee over like this. Now this is my left knee that's bent, so I'm going to be releasing more into my left glute med. So I would just roll to that side. Nice and gently, on and off. And then I would do the other side. Like I mentioned, this fits in quite nicely with side glutes and even from TFL. So you can theoretically go from TFL through to side glutes, across the back of the body, and rolling over and onto the other side. And so you sort of complete this arc of the pelvis running around the back. We're going to come now into the thoracic region. So a couple of watch points here. The thoracic region has a lot of nervous input coming out of it from your sympathetic nervous system. So you want to be quite gentle with your approach within the rib cage. Also, if you are kyphosed, or so you're generally posteriorly sheared, you don't want to be hammering into this position. And you want to make sure you've done some of your front line opening first. We also want to be wary of a lot of hammering into the rib cage if you've been diagnosed as osteopenic or you're osteoporotic through the rib cage and thoracic spine area. But you can get some good results and some very gentle releasing.
the roller at about bra line. It's just a nice central starting position. Now fully support the weight of your head. Don't expect to do the whole thing with it held up here like that. And then look between your thighs. And then we're going to just do a little side bending motion on the roller. So very small side bending. This may be enough for you. And you might want to then just switch down a little bit and do some side bending. Or you can add in a little bit of backwards rotation. So you just rotate and look towards your armpit and then come up again. And rotate and look towards your armpit. Now just notice I'm not doing a massive movement and I'm not trying to get my head backwards onto the floor. It is very much a small rotation, just feeling some tension through the tissue on your back. If you do come backwards to add into thoracic mobility, try and have a sense of elongating the head away from you as opposed to dropping it down backwards. We don't just want to pivot the rib cage, we want a sense of these 2 points lengthening and then coming up again. So pubic bone and sternum elongating, not just pivoting backwards. And this would especially be the case if you're on a short roller or a fully round roller, because this then becomes a lot more violent if you're going to be rolling backwards and forwards. So again, just tilt, small movements, little look into your armpit, little look into the armpit, and just think of elongating and maybe add a little bit of traction to the base of your skull and come up again. Coming up now to my favourite part of the back line, and this is right at the back of the head here. So where your neck joins your skull. So we want to be lying here and just press backwards into the roller a little bit. And then you can slowly look to one side and then slowly to the other. You might want to add in some nods and releases. That would be another option for you. You don't have to stop there. You can move the roller up and work on the back of your head now. So this is on your scalp fascia. Sometimes to finish this sequence off, it's quite nice just to grab a bit of hair and pull, releasing the fascia in your scalp. So just a little bit of a pull and release. And then maybe you can stay here and have a little nap. This is a little extra bonus for you for your calf area. A lot of people do have a little tightness in their calf. Again, I prefer using the half roller. So you're going to sit back and rest the roller on your calves. Now, be very careful here. If your calves are tight, like mine are, it's really hectic to sit back on the roller. So again, you just want to ooze into it nice and slowly, just as you would do cautiously stepping into a hot bath or something. Once you're here, you can sit, and then you can add a little bit of a rolling motion left and right. You certainly, with this exercise, don't want to be doing this, because that wincing again is just going to tighten all of your tissues, and it's going to have completely the opposite response to what we're after. So I hope you like that little bonus. I hope my calves will definitely be thanking me for it afterwards. So remember, when you are doing releases with the foam roller, be very gentle, mindful and respectful of your body. You don't need to do a full body release. You may find that releasing your calves actually opens up and gives some more availability of motion into the hips. Maybe if you release a little bit of thoracic spine or upper abdomen towards the front, it helps you open your shoulders a little bit as well. It's a nice calming and parasympathetic activity to do before you maybe start training, which essentially is more of a stressful environment. It's certainly a nice thing to do before any of your rehab
especially if you're looking at lower limb work such as squatting and lunging, as you'll gain a lot of range of motion in your foot